So, good morning, everyone. I'm Dr. Randy Vince Jr., and it's a pleasure to be here with you today. I want to start by thanking Dr. Salami, Dr. Whitman, and the other organizers for not only the opportunity to present today, but also for organizing a very important program around a topic near and dear to my heart, and that's racial disparities within healthcare. So I'd like to join the conversation by giving a historical perspective, as I truly believe that without this historical perspective, that we'll fall short in our efforts to mitigate these disparities. And so with that, I'll go ahead and get started. So I have no disclosures relevant to this presentation. So here's a brief outline of the presentation for you today. So we want to start by discussing the history of race and racialization in our country. Then we'll move on to review current disparities within social determinants of health. Then I want to analyze the link between these disparities and social determinants of health and health outcomes or health care disparities. And then review some of the current data around racial disparities within healthcare. But I'm going to do this from a broader perspective, as I know we'll have lectures that are more focused on specific topics. So I want to start with this quote from the great Maya Angelou, which I think is very pertinent, in which he said, "I have a great respect for the past. If you don't know where you've come from, you don't know where you're going." So where have we come from? So I think, when establishing this historical perspective, we have to start with our country's origin story. And, as a part of that origin story, we have to have a great acknowledgement. Chattel slavery was a major economic engine for our developing country. And one way of looking at why this development of race was important during this time is that Black slaves and indentured white servants would often work together to escape these morbid conditions. Well, if you start to develop this concept to separate people based off of skin color, this now led to the concept of racialization, and white servants or white indentured servants became overseers while Black citizens remained enslaved. Additionally, we started to have the rise of anti-Black racism and pseudosciences that were published as medical research to support or justify slavery. And often these things would start by saying, or, ultimately try to justify slavery as saying that it's a natural evolution for Black people. And because this is a social construct, we've had ambiguous blood fractioning laws to determining race, like the one drop rule or the 1/8 rule that many of you have heard about. And since that time of slavery, we had the criminalization of education for Black citizens. We've had Jim Crow laws that confine Black people to poor areas of the community or cities as a way of legalizing segregation. We've had redlining, which many of you have heard about, that have prevented home ownership and thus prevented the generation of or the creation of generational wealth. And this has a number of implications outside of just home ownership, right? So, in addition to not having generational wealth, when you have a lack of home ownership within a community, this can negatively impact, the funding for schools and things like that. So it's more than just the creation of generational wealth. So this is just a broad outline of where we've come from in terms of our history. And now I want to move on to how it has current day impacts in what we call social determinants of health. But before we do that, what exactly are social determinants of health? Well, this is from the Healthy People 2030, and this is from the Department of Health and Human Services. And it states that social determinants of health are conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. And then, we further look at this as in these domains, which you can see healthcare, access and quality, neighborhood and built environment, social and community context, economic stability, and education access and quality. And I speak on each one of these because, as we look at it, we have a litany of data that is out. It shows that Black people are more likely to live in highly polluted neighborhoods, like this article here. It shows that income inequality is prevalent. So many Black people are forced to live in poverty. And undoubtedly, this translates to increased violence in the neighborhoods. School funding is impacted, which leads to decreased education quality. And us is also linked to an increase in crime. And then, we also have barriers when it comes down to equal access and healthcare and quality of healthcare as well. So these are just a few examples of some publications that touch on each one of those domains of social determinants of health we just talked about. And how does this manifest? So when I say I wanted to attack this from a broader perspective, I want to start with just thinking about life expectancy. And I'm doing this specifically because I know we'll have more focused lectures on things like prostate cancer, which, we do a lot of research and there's a ton of data around the disparities there. But I want to just look at this broadly from a life expectancy standpoint. And I put this slide intentionally here. I often like to refer to this because this is a personal story, and it kind of shows and lays out the picture of what we're talking about. So this was a news report in my hometown of Baltimore, Maryland. And what you can see is on the right is the neighborhood that I come from, which is technically classified as Greater Mondawmin area. You see the median life expectancy of 70.4 years. And then on the left, you have the Roland Park neighborhood. And the reason why this is, very specific to me or personal to me is I remember being a kid in elementary school and taking standardized tests and doing really well at the math portion of the standardized test so well that they offered me a partial scholarship or financial assistance to be bused from my neighborhood to attend school in Roland Park, which is very different in terms of demographic makeup, but it's only separated by a few miles. And so, as you can see here, this is almost a 14-year difference in life expectancy. And when I say this is only separated by a few miles, I truly mean it's probably less than 3 miles difference. But again, the demographic makeup is very different. And this is prevalent no matter the city. So whether you're talking about my hometown of Baltimore, Detroit, Cleveland, where I currently reside, or Richmond, where I did my residency training, hopefully you can see my mouse here, but the Gilpin neighborhood, which is literally right around the corner from the health system or the hospital where I did my residency, median life expectancy of 63 years old. And this is less than a mile and a half from the museum district, which is 77 years of age. And so you see this 14-year gap. And again, it's only separated by maybe a mile and a half, but the demographic makeup is very different. So again, this is kind of how these social determinants of health or disparities within what we classify social determinants of health end up impacting people's lives negatively. And again, it's a clear link between the historical events that have happened and the policies that have been in play, the disparities that it leads to in social determinants of health, and the ultimate health outcome disparities that we see. And then just to kind of spin this one, just kind of talk about this in one more way differently. These are the top causes of death nationally. And what you can see is this is 2020 and 2021. And if I were to focus on it, if I were to go and dive into each one of these, we would see a racial disparity there because I've done it. But in the interest of time, I'm only going to focus on the top three. And what I want to show you is that whether we're talking about cancer, so in this specific instance, this is colon cancer, where we're talking about cardiovascular disease or COVID, which has been widely publicized and we all know about it. Black people are more likely to succumb to these conditions. And a large part of that is linked to these disparities in social determinants of health. So in final thoughts, I just want to state that we have to be mindful that race is a social construct and racialization was created to divide humans based off of their skin color. This is not a biological construct, so we need to move past assigning a risk to someone just based off of their race because race is not a biological construct. Efforts need to continue to, alleviate or erase these racist policies that were intended to support a racial hierarchy. Again, we have to acknowledge that the history of racist policies has current day implications. Disparities within social determinants of health lead to disparities within health outcomes. I think now we're doing a better job of thinking through this, but this must continue. And then ultimately, to bring about change, we got to acknowledge it again. I can't emphasize this enough. Race is a social construct. We have to examine these policies for inequities because, it's one thing to say this happened a century ago, but it still has contemporary impact. And then again, we have to systematically address these racial disparities within social determinants of health. So whether it's, economics, instability, education, healthcare access, and quality, all of these things have to be systematically and addressed, and we have to do it at a structural or system-wide level. So I often in all of my talks like this, so I want to just give a quick shout out and thank you to my mom and dad. My dad and I on the left. Unfortunately, I lost him at the age of 12, but I navigate this world hoping that I can be a man that he can be proud of. And then my beautiful mom on the right. So I want to just acknowledge them and thank them for the love and support they've given. And then I'll end on this one quote from Mahatma Gandhi, in which he says, "Be the change you wish to see in the world." And so I challenge everyone here to be that change, because without us as change agents, things will continue to remain stagnant, and we really need to push for progress. And so with that, I'll end. Again, thank you to Dr. Whitman, Dr. Salami, all of the organizers of this program for the opportunity to present. And I look forward to seeing everyone shortly. Take care.